So now, so we were discussing regarding the various types of research. Any doubt from the last topic? Any doubt?
No, sir.
Okay. Now see, what we are discussing about the different types of variables. So I told you like there are two types of variable, dependent variable and independent variable. So dependent variable, if we say, it is basically, if you summarize the dependent variable, it is basically your uh, outcome measures, right? And independent variables, we will be simply classifying them as your intervention, which is given to any group. For example, like I said, if you take two groups and you want to compare between two drugs, okay, or you want to compare between two vaccines. So these two vaccines will be your independent variable because these are the intervention. And on which parameter you will be comparing the two vaccines, okay, maybe how much it is effective in reducing the temperature, how much it is effective in fighting with the antigen. So like we will be defining these things as your, because dependent, these things are dependent on your independent variable. So you need to be very clear, like there is dependent variable and there is independent variable. Dependent variable is your basically your outcomes or the outcome measures, whereas the independent variable are your intervention. Is this clear to everyone? Is this clear to everyone?
Just for example,
Huh.
if you are measuring a blood pressure,
Okay.
and we have some these and this is a this measurement of blood pressure dependent on height, weight, age. So
Yes.
so those, this is depending on those factors, those variables.
Yes. So now suppose you are taking, so see, blood pressure will be depending on your these variables, these
Age, weight,
body
height.
factors, yes. These anthropometric factors. So these are the anthropometric factors. So blood pressure is dependent upon them. So then the blood pressure will become the dependent variable, and these factors will become the independent variable. So now if you want to do a research to see, like out of these 4 or 5 factors, which factor is most potential or have got the maximum effect on blood pressure, okay, so then it will be, this type of a study will be a causal study, that this factor is most significant among all the 5 factors which can basically influence your blood pressure, right? And suppose if you are doing any study where you are basically comparing two drugs to see, like suppose the blood pressure of a person has increased tremendously, okay, like from 150, so for example from 120, suppose somebody is having 180 or 190, and see like which drug is acting in the most shortest possible time in bringing the blood pressure back to the normal values. So then the blood pressure will be a dependent variable over here, and the drugs will be an independent variable. Is it clear?
100%.
Okay. So we mean to say, we really need to see, like, what are the factors which play an important role. Now here is, take this example. Suppose for there is a study purpose. The research study says we want to compare two different ways of teaching social skills to the people. Okay. So what you are basically comparing, you want to compare two different types of teaching social skills. So one skill is role playing, the other one is watching a videotape. Okay. So what is the causal variable over here? The causal variable over here is the teaching method. So you are basically comparing the teaching method, two different types of teaching method. And you want to say of teaching method, on what aspect you want to see? The social skills. So the social skills is basically the effect variable, and you want to see what are the other variables that can play or influence these teaching methods. So then they will be known as the potential confounds. Okay. Now see the procedure. Like we have taken 10 pairs of 6th grade girls who role played an initial meeting. Okay. While we took 28th grade girls who watched a video about meeting new people. So these are two different types of skills that we are so here in one group we have taken 6th class girls, the 10 pairs, and there the 10 pairs means again 20 people you have taken, and there you have taken basically 20 girl students, so 20 in each group. And then all the participants took the social skills test. Now what is varying over here is, now see, the constant factor is the gender, because all of them what you took are the girls. Okay. And then you want to see whether there are any confounding variables over here. For example, the age, okay, or the grade difference. So maybe one girl is 13 years, the other one maybe, but they are all 8th class girls. So most likely they will be probably be of the same age. So how do you know that what variable to control so that they don't become confound? So we really need to find like what are the confound. So compounding factors are those other factors which can influence your results. Okay. So this is again one type of a different type of a research which is being used in various causal effect relationship studies, where we want to see the cause and the effect of any, for example, like whether smoking causes cancer or not. If smoking causes, now there will be people who will smoke but they don't get cancer. Now, and there are people who smoke and they get cancer. So that means what is that extra factor in those people, whether it is genetics or whether it is the number of cigarettes that you are smoking per day, or you are basically having some other factors which can influence in the development of cancer in such patients. So then it will be type of a causal effect relationship study. Is it clear to everyone?
Can drinking?
Drinking, the same
Yes.
thing also with drinking. Yes.
So
Okay.
compounding factor.
That can be a yes. So you see, so these are different types of so when we are doing any type of a study. Okay. So maybe we are comparing between the various confounds. We basically are trying to see like so one part of the study, what I said is like your cause effect relationship. Now if suppose I want to see the influence of um, corona. Now suppose if there is a research study in public health. Now the girls, suppose the female student, the female the females might say, like after taking corona vaccine, okay, vaccine for corona, they see a change in their menstrual cycle. Okay, that may happen or may not happen. Now if I want to do a real study, that whether definitely whether people will say yes, after taking the corona, the menses are coming very frequently, or it is not coming at all. Also, so whether there is an effect of vaccine on the menstrual cycle, so that might be a research question. And then what are the various factors that can influence whether the female was having what was the weight of the female whom you are taking into your study. Okay, what is their age group, what type of profile, health profile they have. Okay,
One factor
or
may be nutritional anemia.
anemia or not. So there could be so many factors in this. So, and if you are confident enough, like, are we confident enough to say, like, yes, definitely the vaccine might have caused some changes, or no, the vaccine has caused no changes. So now how to confirm this thing? So only by means of doing a public health research, we can confirm such a thing. Is it clear to everyone? Yes, Babicha, is it clear? Ujwal?
Yes, sir.
Okay. So then there are other types of research, like I told you, where we actually do experiments. The first type of research, what I said, is a causal based relationship, where we see a cause and effect relationship. The other types of research in public health that we basically do in order to see, compare. Okay. So we basically can, we want to compare between two methods. We want to compare between two interventions. So, there will be different types of research design. Just a minute, just a minute. Okay. So when you do actually a true experiment, in true experiment, we have to take hypothesis. So research hypothesis is very, very important. So in research hypothesis, there are two categories. One is a null hypothesis and other is an alternate hypothesis. Okay. Now, before doing any, so you can see over here that research hypothesis and alternative hypothesis. So research hypothesis can be of two types. I told you alternative hypothesis and null hypothesis. Null hypothesis means, like, for example, I would say by taking this drug, it will have no effect on that person. So this is a null hypothesis, okay? Because I know that A, or suppose if I'm comparing between two drugs, A and B. So what I said also in the last time, A is equal to B. When I say A is equal to B, that means both will have either same effect or both will have no effect. Then it will be called as a null hypothesis. The opposite of null hypothesis is known as alternate hypothesis, which means A is not equal to B. What does it mean? That means either A is greater than B or B is greater than A. That means I'm not sure whether, for example, same like now what I said, like whether vaccine will have an effect on the menstrual cycle of the females or not. If I know the answer, no, it is not going to have any effect, then then I would say that A is equal to B, that it is not going. So I'm very confident that it is not going to have an effect. Okay. Or I would say, no, it will have an effect. Now, having an effect means whether it can increase the menstrual cycle or it can cause amenorrhea, like means where there will be no menses. So here I'm not sure, like whether it is going to increase or going to decrease. You got the point? So wherever we are in a doubt, we don't know the answer. That's why we try to take up research. And by taking up a research, we first try to create a hypothesis or an assumption. Based on that assumption, we try to create a methodology that how I'm going to test my hypothesis. And for this, I need to prepare a whole research design. This is what a research design basically means. Is it clear?
For example, if we choose like this, that corona vaccine, taking corona vaccine will give rise to polymenorrhea. If this is the hypothesis, if this is what we want to prove, so our null hypothesis will be the vaccine will not cause polymenorrhea.
Vaccine will not cause polymenorrhea. So that means if I would say, in other words, the vaccine will have no effect on the menstrual cycle.
Yeah.
Okay. Whether now and the other hypothesis, yes, it will affect the menstrual cycle. So null hypothesis, it will have no effect. So that is a null hypothesis.
Yes.
Okay.
Yeah.
So if I say that no, it will have an effect. Now the question comes whether the effect will be more or effect will be less. Whether it causes it increases, okay, it causes polymenorrhea or it causes amenorrhea, right?
But suppose if I don't know that vaccine causes, whether it causes polymenorrhea or it doesn't cause polymenorrhea, then at that time, what will be my null hypothesis?
So this is what I'm saying. When doing a study, actually, I'm not sure about the answer. That's why I'm doing a study, right? So before the study, I will write both the statements.
Okay.
My null hypothesis is this, my alternate hypothesis is this.
Yeah, I got it.
Now may the best thing win. Now, and secondly, suppose you do a research study, then what you do, you need to take a samples. Now the question will come, the people are going to ask you, okay, if you want to do such site of a study, okay, fine. Then which sample or the which type of a cohort you will be taking? Okay, whether you will be taking girls of which age group? Okay, and so that means you need to have a proper inclusion criteria, because you cannot say I will take all the girls who are more than 18 years of age. So you have to define maybe from 18 to 30 years of age, what will be their age, what will be their body weight, what will be their height, what will be their general health status. Now if you, based on those inclusion criteria, if you say, okay, I will take all the girls from 18 to 30 years, all the girls will belong to maybe not even that sort of a difference, maybe from 18 to 25 years, they will be unmarried. Then the BMR would be the BMR in such case will be less than 30. Their weight will be around say 50 to 70 or 60 to 70. So if you define so many criterias, and then you say, now I gave them vaccine, and I what I saw, and secondly, yes, whether they had a means before the vaccine, all of them had got regular cycles or not. Then only you can compare, like, what happened after giving the vaccine. So that means you have got a homogeneous group. If your group is not homogeneous, then you can never be sure like about the results. Is it clear?
This will be just like a case control study.
It can be type of a case control study, and then you can actually take different type of groups within the same. If you say, like you say you have taken one group of people who have a BMR more than 30, and there are girls whose BMR is less than 30, or can also vary in the weight, to see actually to which age group it affects and how does it affect, what are the various variables that may play an important role. Now suppose if you see, like, there are girls who has the weight on a higher side, and there you see more defined or profound effects of vaccination, then you can write in your discussion based on the type of result that you say, that there might be something which is happening in such girls which might be leading to such a scenario or such a sign. So in research, when we do a true research, there is nothing fixed, because you basically want to see the phenomena, you want to see, and you want to observe it very keenly, and based on those things, you really need to be sure about, like, what you see is basically contributing, what factors are contributing to such. And and while you collect that data, like, what type of a sample have you selected, what was your sample size, what was your inclusion criteria, what was your exclusion criteria, how did you did the data collection in such cases, whether there was any variable, whether you have performed blinding or not. By the way, what is blinding? What is blinding in research? Anybody?
Blending means just to avoid the bias.
Bias. Okay, so what is the difference between a single blinded study and a double blinded study?
Single blinded means the participants will not know,
Okay,
and in case what is happening to them. But in
okay.
case of double blinded study, the participant as well as the person who is doing intervention, they will not be, both of them will be not knowing to which the participant, to which
Both of
group
them will be
form.
not knowing.
No, no.
So
And
it is basic.
yes, and there
Yes.
is another triple blinded study, because in that case the participants, the person who's taking interventions, and also the persons who are involved in the analysis or the research and about the,
Analysis,
yes,
reading, data
yes, he
collection.
will be also
Okay.
not knowing.
Yes, they will also be not knowing. Yes. So and why it is done, in order to prevent any type of bias. Okay. so that you can manipulate the results. So in any type of a study, in true experiment, all these factors play a very, very important role. So because that's why it is written over here. See, treatment or manipulation performed by the researcher provide temporal precedence or ongoing equivalence. So internal validity is very, very important. Like, how do you collect the data? Because all of these things will have a very important effect, and these all things we basically put to test by statistical analysis, and we find the p value. What is p value, by the way? Any idea? Because you must all have studied or some research papers, and everywhere it is written
it
p.
is a test for of significance, and how much the risk factor or the causal factor has an association with the. But it is a method to determine the association with the cause and effect.
Okay, now if I say, now what it is written over here, p is less than 0.05. Okay, and confidence interval 95%, p is less than 0.05. Suppose my p has come to be, p is equal to 0.03 or 0.003. What does it mean? What does it mean? Yes, Rajiv, have you seen any in any of the research paper? It is written over, the value is written over there. P is equal to 0.003, p is equal to 0.0232757. Yes, Rajiv, any idea? Because these are all a part of your research design to tell. Like, for example, suppose we calculated in this example, say, when we took all the girls of the same age group, that was a homogeneous group, and suppose my p value came out to be 0.003. What does it mean? What does it mean? What is the inference of it? Yes, Premavati. What is the meaning of such?
I think the level of significance is low.
Level of significance is low.
Yes, I feel so.
What does it mean? But what is the meaning of it? P is equal to, like, suppose if I say, if there is a weight of a person, the average weight should be for a 65-year-old, for a person of 5.5, 65 is the average weight. Now if it is coming to be 75, 80, that means the person is 15 kgs overweight. Okay, same like if this value comes 0.003, what is the meaning? What do you understand by?
Much difference in the data, in the value of the data that we are getting. I think there is much difference in that. The range is
Okay,
very.
the first question number one. Now, if the value came out to be 0.003, whether it is statistically significant or it is insignificant, the results are statistically significant or insignificant?
Insignificant.
Is statistically significant.
Okay, Dr. Hussain is saying it is significant. Okay, what about Rajiv? Yes, Rajiv. Is it significant
It
or?
is statistical significant.
Huh?
Statistically significant.
Statistically significant. Okay, good. Okay, yes, Rajiv. Rajiv is not there or what? Okay, it is significant. Now the question number second. Okay, I agree it is significant. Now what does is the meaning of P is equal to 0.003? What is the inference out of it? What do we understand by this value? Yes, Dr. Hussain, what do you think? What is the meaning of 0.003?
Recapitulate.
Huh?
Sir, actually p value is 0.05 is greater than, is not statistically significant.
No, agreed.
No,
The
but the question is that what is the meaning of 0.003?
0.003 is greater than 0.05 or less than?
It is less than. But what is the meaning of 0.0003?
Yeah, this is what I'm asking. What does it mean?
Yes.
Isn't it? We see in a lot of research papers, you see everywhere they have quoted this value. And they write it is statistically significant. The results were found to be statistically significant. P is equal to 0.003, 0.004.
P is equal to simply psychology.
What I think so.
What
I
is
can
P?
try. Yeah,
What
I
is
can try.
P? Yes,
I
please.
can try.
Yes.
It means that 0.03 means 3 divided by, 3040. This is the probability. The chance probability is very, very, the chance of probability chance of association will be least, I think.
Okay. Okay,
There is a
very good
strong
attempt. Okay.
This is I can just
Okay,
try, but
no issues. See, we are all discussing
the
anyway.
probability is very, very poor of not having this association.
Not having this association. Exactly. So the number one, P value stands for probability value. Okay. What is the chance? What is the probability? For example, you must have known, you were doing, if any of you have taken mathematics in your class 12, you used to do probability equations. For example, if I take a dice, okay, and I take a dice while playing Ludo, and what is the probability that if I put the dice 3 times, what is the probability of 6 coming every time? Okay, so that means we want to test the probability. Now over here, when I say point P is equal to 0.003, this means that out of 1000 times, because point, how many decimal places? 3 decimal places. So if I do this experiment 1000 times, there is a probability that such a result, okay, might happen by chance 3 times. It might happen by chance, but 997 times it will be 100% because of this factor. Is it clear to everyone? Is it clear? What I said, if suppose the value is 0.003, that means suppose I've taken this experiment of that after the vaccine, if suppose, yes, we see a difference in the menstrual cycle, then I would say that 997 times, there is 100% chance that we see a difference in this, and it is because of, I'm 100.003% sure. Okay, I am almost 997 times sure that it is because of this. 3 times it might happen by chance. We don't know. So 0.003 is almost equal to very, very closer to the 100%. So that means we are very sure about the experiment that this factor, like for example, the association between cancer and smoking. So in any smoking study, you will see there is always the p-value will be found to be statistically significant. That means
below
if we take
0.05, below that.
Yeah, that means there's a huge correlation between the two things. There's a absolute, which is statistically significant, that this factor is responsible for this thing. Is it clear?
Yes, sir. सर एक बात है, जब p वैल्यू 1 होगा तब कितना % होगा?
नहीं, तो p वैल्यू 1 की बात नहीं है ना, p वैल्यू तो आप हमेशा 0.05 ही लेके चलते ना भाई. तो पी वैल्यू को
Okay,
आप तो पी वैल्यू दो जगह पे लेके चलते। देखिए ये डिपेंड करता है कि आपकी स्टडी कितनी सेंसिटिव है। फॉर एग्जांपल अगर जब आप ड्रग टेस्टिंग की बात करते हैं तो वहां पे इतना पी वैल्यू आप 0.05 नहीं लेके चलते हैं, वहां पे पी वैल्यू आप 0.01 लेके चलते हैं। ठीक है, मतलब
Okay,
100 में
sir.
से एक केस, 100 में से एक केस में शायद ये बाय रैंडम हो जाए, तो यू हैव टू बी डबली श्योर। वहां पे ये नहीं कर सकते, क्योंकि अगर बाई चांस दूसरे किसी आदमी में उसकी वजह से साइड इफेक्ट हो गए तो इसलिए मैंने आपको बोला था दिस टाइप ऑफ अ वेरिएबल इज व्हाट, दिस टाइप ऑफ अ वेरिएबल इज योर रेशियो वेरिएबल। क्योंकि इसमें देखिए आप पॉइंट डेसिमल प्लेसेस तक गिन सकते हैं, जितने ज्यादा डेसिमल प्लेसेस उतनी सेंसिटिव आपकी स्टडी है ना।
Okay, sir.
आप
Okay.
उतनी गहराई में उस चीज को बता सकते हैं कि भाई अब जैसे मैंने कहा किसी के 99 मार्क्स आए और किसी का 100 आए, मैंने परसेंटाइल में आपको एग्जांपल दिया था। अब किसी के आए 99.1, अब किसी के आए 99.12, 99.13, 99, तो भैया 99.14 वाला 99.1 से तो बड़ा ही है ना, उसके मार्क्स उससे ज्यादा है ना भाई।
Yes, sir. Yes, sir.
अगर
Okay, okay.
99 से 100 के बीच में अगर क्लास में ऐसे 10,000 बच्चे हैं, फिर कैसे कैलकुलेट करोगे? तो आपको उतनी आपका जो न्यूमेरिकल वैल्यू होना चाहिए वो इतना सेंसिटिव होना चाहिए कि पॉइंट डेसिमल प्लेसेस के बाद में भी कितने डेसिमल प्लेसेस तक वो गिन सकता है। तो इसका मतलब है, तो मतलब
Okay,
आप
sir.
उतने डिटेलिंग में जा सकते हैं। अब दुनिया की नजरों में 99 100 के बीच में भैया 99 वाला बहुत अच्छा है। अब जैसे एग्जांपल ले लो, एसआरसीसी का रिजल्ट आता है श्री राम कॉलेज ऑफ कॉमर्स का हर साल, आप देखना दिल्ली यूनिवर्सिटी में। दिल्ली यूनिवर्सिटी के अंदर जब उसकी कट ऑफ निकलती है तो 99 से लेके और 100 के बीच में, है ना, दूसरी कट ऑफ तो कभी आती ही नहीं है। मतलब सारे के सारे जो अप्लाई करते हैं सबके 99% होंगे या 90, कभी एक आध कोई सीट रह गई होगी तो शायद उसको 98 वाले को चांस मिल जाए। अब आप हिसाब लगाओ फिर, मतलब कितना कंपटीशन है। मतलब जितने ज्यादा लोग, अब सभी के अगर 99.1 2 3, अब उसमें भी उनका कुछ सिलेक्शन क्राइटेरिया रहा होगा, तभी वो कट ऑफ निकालते हैं कि भैया कट ऑफ क्या है, तो कट ऑफ में निकाला 75.2% कट ऑफ है। आर यू गेटिंग दैट पॉइंट? तो आप
Yes, sir.
देखिए,
Yes, sir.
है ना, तो पॉइंट डेसिमल प्लेसेस की बहुत वैल्यू है भाई। उसके बेसिस पे जो बहुत सेंसिटिव स्टडीज है जैसे फार्माकोलॉजी वगैरह में इन सब चीजों को इस्तेमाल किया जाता है, और वो बहुत ही हाईली सेंसिटिव स्टडीज हो, तो इसलिए आपको बहुत वेरिएबल्स को बहुत देख के यूज करना पड़ता है। सो यू रियली नीड टू बी वेरी careful about, where in biological studies, in pharmacological studies, you really need to be very very sensitive, you very careful about the type of environment where it is being done, because any confounding variable can cause a change and which might have a very different effect on your results. Okay, so these are
Okay,
all
sir.
examples what we just discussed. These are all examples of your true experiments. Then there are again quasi-experimental studies which is not true. So there here what we do, there's no random assignment of the individuals, because in true experiment we randomly assign to the student our subjects in any group randomly. So random, so there when I will be teaching you sampling, we will be using that how this randomization is being done. What are the different types of sampling? What do you mean by snowball sampling? What do you mean by quota sampling? Okay, so we will be probability sampling, non-probability sampling. There we will be studying in more details like how this assignment of the subjects is being done. And here you also use experiment or manipulation. However, there is poor or no control on the procedural variables over here. So these type of experiments are basically your quasi experiments. These are type of experiments you can see in any social sciences research, where you cannot control the variables. Okay, like for example the environment where the children are studying, the effect of the various environment over the health of the children. So there you cannot control lot of things, so the procedure variables is not under your control. And then the third different types, like where basically you have got various correlational design, where we try to see correlation between two variables. Okay, whether there is any correlation. Suppose you took any socio demographic factors, For example, if you suppose you want to see the effect of Ayush Yojana, okay, the not the Ayush, this what Ayushman. Suppose you want to say, okay, Ayushman Yojana has been created for the people whose income is less than 5 lakhs. Suppose now the government says a lot of people are the beneficiaries. Actually, these people are the beneficiaries during COVID. Whether such sort of a health insurance has really helped the poor people, yes or no? If yes, how? If no, why? Okay, so these type of studies can be defined under correlational studies, where you try to see various variables and you want to study the impact of those variables over the subject as well as the scheme in public health. Is it clear?
Yes, sir. Yes, sir.
Okay, so I've defined what is independent variable, dependent variable. So we have all done these things. Okay. So some of the categories, see, in independent variables, like I told you, example, gender, age, siblings, ethnic background. So in public health, these things are the social demographic factors. Okay, these can be labeled as independent variables over here. Okay, in different type of then you see within, when you do an experimental study, there are again a different concept known as the between group and within groups. Okay, so what is the difference between groups? Because see, why it is important to know all these things, because we use different types of statistical tests while evaluating the results in the subjects. So can anybody of you tell me the difference between groups and within the groups? Yes. Between and within. Yes.
Between groups means what we see here, it is just like a cross-sectional study, no?
Okay, yes, it's a type of a cross-sectional study.
because it is just like a snapshot.
So can you give me an example of any
Yeah.
cross-sectional study in
Yeah.
public health?
We can take the example of COVID,
Okay.
and at a particular time, there will be only one. There will be the one-time study in a particular group for a known period.
Okay.
And from there we can derive the disease burden.
Okay.
So here we can have the prevalence rate.
Okay. Okay, you can find the prevalence. Yes. Yes, anybody else? Any other example? Yes, Ujjwal. What do you mean by between group? See, it is also called as between subjects or cross-sectional. So each participant is one and only one of the treatment or conditions, and different group of participants are there in each treatment or condition. So it is used to study the differences, okay, in those participants, or so maybe can difference. Or so for example, if I want to test, suppose I want to see the addictive behavior. Now during Corona, suppose the children all the children were, the schools have not opened for the last 2 years, suppose. And children have been asked to study in a different environment, because usually before Corona, the children used to go to school, they used to socialize and everything like that. Okay. Now, since they are at home and they are being conditioned in a different environment than the school. So whether that type of environment has caused any change, for example, like addictive behaviors towards mobile phone. Okay, now I want to do a cross-sectional study to see the knowledge, attitude, and practice of the parents regarding any type of addictive behaviors among such children. Okay, post-corona. So I really want to see the prevalence, whether, you know, gaming or mobile addiction has increased after Corona in such children. And if it is there, then what is the knowledge level of the parents regarding the same? And what is their attitude? Because parents, might be the parents themselves are suffering from that addiction. If they themselves are suffering from that addiction, how they can stop their children? Isn't it?
सर और एक भी होता है जो एडवांटेज डिसएडवांटेज.
एडवांटेज डिसएडवांटेज का मतलब मैं समझा नहीं.
सर मोबाइल यूज का जो एडवांटेज कुछ लोग अलग वे से देखते हैं, जो मतलब उसका एडवांटेज लगता है, कुछ लोग डिफरेंस होते हैं उसका डिसएडवांटेज लगता है.
व्हाट यू आर टेलिंग इज वो एक अलग एस्पेक्ट है, पर यहाँ पे देखिए, व्हेन यू डू एनी रिसर्च यू हैव टू बी वेरी फोकस्ड. यहाँ पे हम ये जानना चाहते हैं, बिकॉज व्हेन यू विल बी डिफाइनिंग द सब्जेक्ट, suppose I want to see the knowledge, attitude and practice of the parents regarding their children in terms of their addictive behavior. So here I am defining it very categorically that we want to study the prevalence of this disorder among the children, and we want to know the knowledge and the attitude, whether they really understand that there is a problem with the children or not. मैं ये नहीं कह रहा वहां पे एडवांटेज है डिसएडवांटेज है, मैं ये मान के चल रहा हूं क्योंकि हम जब अपना व्हेन वी विल बी जस्टिफाइंग, वी वुड से लाइक सच एंड सच थिंग हैज हैपेंड which might have caused some behavioral change, and there might be an increased incidence. We are hypothesizing that there might be an increased prevalence of addictive behavior of children after Corona. Now, whether it is actually there, what is the prevalence rate, whether it is 10%, 20%, 30% out of the whole sample size. Now, for any practical reason, if I take the sample size, say like 324 sample, okay, if I take, so it can be by any yardsticks, it is quite a safe sample size for any publication. But the more the sample size, suppose the population of a place is say 10,000, 20,000, 50,000, 1 lakh, 2 lakh, 4 lakh. So still, whether sample size of 324 will suffice for that type of a population to justify, that we need to see and ask the statistician, or we need to do a statistical test in order to find the actual value. But what I am trying to tell you over here is, like, it is not a question of advantage or disadvantage, a question of like where I want to see a particular behavior in a range of subjects. So I want to see a cross section at any point of cross sectional means at any point of time. We simply take a questionnaire, we go to the audience and we give it to them, we take their responses, and based on those responses we try to find out like whether the phenomena is present or absent by taking a particular criteria. This is what do you mean by, so that's why we said between subjects, between group A and group B. So there are two categories of people and of the same issues, and we want to say which are being affected and which are not being affected, by which we can calculate the prevalence rate. And when we say within group design, is it clear? The cross-sectional study is clear to everyone? Yes, cross-sectional study is clear to everyone?
Yes, sir.
Okay. And what is within group design? Within group design. It is also written within group design or repeated measures or longitudinal. Yes. Yes, what is the difference? What does it mean? What is the other name for longitudinal studies?
I think it is a descriptive, no?
No, it is not descriptive, doctor. Descriptive, you can say we can describe the entire phenomena, but what do you mean by longitudinal studies? Longitudinal studies you can also name as cohort studies. Okay. Now, for example, I have seen the same person. I am taking multiple readings. I am taking maybe after 15 days. Again, I am taking after 30 days, or maybe after I am taking after 1 month, then 6 months, then 1 year. So I'm going to see and observe the changes in the same population. I'm comparing between when I saw on a baseline and when I saw after 15 days. Then when I saw after 30 days. So whether there's a difference between first day and 30 day, whether there's a difference between 30 day and 15 day. Okay, then whether there's a difference between 30 day and the first day. So there can be different at different time periods.
I have
When
some. I have query here.
Yes,
Just as we have, it is known to us that between the groups. Acha, within the
between the
group
groups.
means suppose I have taken one mahalla, then there is another mahalla,
Okay,
and within these two groups means all the characteristics of the participant will remain keeping the same.
okay,
Age group will be the same, sex will be same,
okay.
other things remain the same.
So inclusion, based on the inclusion criteria, you take
Criteria,
a
yes, yes,
homogeneous group.
yeah, yeah,
Yes,
yeah. So
yes. Okay. Yeah, Dr. Hussain, kindly unmute yourself. It is showing you are muted.
yeah, yeah, yeah. So suppose we have one group A in a particular locality,
Okay,
suppose in past circus, and there is another group B situated in the Raja Bazaar. So
okay.
we have two different groups. Now in two different groups we have participants, but we have to match the characteristics.
Yeah,
Because,
this is what I am saying. Now,
yeah.
suppose when you are matching the, for example, you have taken the common characteristics. For example, you want to see in both the places you have got disabled children. Okay, like in
Yes.
Raza Bazaar,
Hmm.
Raja Bazaar, suppose this area belongs to a poor locality.
Hmm.
Okay,
Hmm.
and Park Circus belong to a rich locality.
That
Suppose.
will not be there. That
Okay, so
because the area will that area should be the same, na?
no, even
The
if it is suppose there are two areas. Suppose if I am saying.
mhm, mhm.
Okay, but the common criteria is these are all parents of disabled children. Okay,
Acha, acha, acha.
and now you want to test their knowledge and attitude regarding the disabled children.
Acha,
So
okay.
first thing, okay, so even but the common criteria, because you have chosen a common inclusion criteria, that
Mhm,
these should be all parents of disabled children.
mhm,
Now, in order to whether to say, now suppose you said tomorrow in your objective you might write, I really wanted to see whether there's a difference in the attitude and the knowledge of the people who live in rich area or in poor area. That means you are hypothesizing that if such a scenario happens in poor people, then the effect of the problem will be even more potentiating as compared to people who are in rich area, because it might be influenced by their education level, it might be influenced by their economic status, okay, which can have an effect on their knowledge and attitude regarding their behavior towards such children. Okay, it may be or it may not be.
yeah.
So there you are finding firstly, like what is the knowledge level of such people, what is their, now whether that knowledge is actually culminating into attitude. Now there are people who have got a very good knowledge, but their attitude is poor, and when the knowledge and attitude is poor, then
The
the knowledge
practice
is good,
becomes, yeah.
then practice definitely
Mhm.
will get affected.
Yes.
Okay, so these types of all the studies are basically cross-sectional in nature, because it is basically a between group study. And when you are doing now, if suppose if you are choosing any now suppose the in the same study
Yeah.
you have chosen 100 children
Mhm.
who are suffering from cerebral palsy. Okay,
Okay. Mhm.
and such children you are giving intervention because you have been visiting that
Time
CP
to time,
home
yes.
or physiotherapy center right from now, and you are doing a longitudinal study for the next 5 years,
That means in a cohort
where you
study.
see, yeah, okay, so that is a core. So here you see what type of a changes, socioeconomic factor changes, which is happening at year 1, year 2, year 3, year 4. So
Yeah.
within the same subject, you are,
Oh,
or if you are
acha.
giving an intervention, then if you are giving an intervention in such thing, then you might be taking a longitudinal study where you will be taking a reading on baseline day 1. For example, like I told you, if suppose if you are giving treatment and you are giving treatment for osteoarthritis for so the title of the treatment, you might say, okay, to see the long term effects of physiotherapy on knee osteoarthritis, or a particular therapy on knee osteoarthritis. So where you said, okay, you are treating the pain, you are treating the other issues, and then you are asking the patient, and you are asking the patient to go for exercises at home, and then you evaluate the same patient maybe after 2 months, then after 5 months, then after 7 months, and then
That means
after
they have
9
to be
months. And
regularly followed up.
there has to be regularly. Then you can actually do a comparison between what was the difference on day 1 versus week 7, first week, after second week, after a month, after 6 months. And then you can say categorically that whether physiotherapy will be really effective in such people or not. Okay. Because then the other variables will also act. Maybe the person is not so you say those people who are regular with their exercises, at least 30 minutes a day, have found to have a better clinical outcomes as compared to those people who are not disciplined and who are not regular in doing exercises. Okay.
Yeah,
But
yeah.
how did you come to this conclusion? Only when you do a longitudinal study, where you do an within group comparison. So in the same group, you are taking a reading on day 1, day 5, day 7, day week 1, after 15 days, okay, after a month, 6 months, like this.
Sir, actually repeated observation of the same variable.
Repeated
Over-
observation of the same variable. Yes, very true.
Yes, sir. Yes, sir.
So that is basically your within subject repeated measure, that is also known as repeated measure or longitudinal study.
Okay,
Is
sir.
it clear?
Yes, yes.
Okay. So this is the other aspect. So this is between group. So you have already known this thing. Then okay, then you see this table. Now putting all this, here's the summary. Like you see, between group and within group, true experiment and non-experiment. Now, uh, have you studied anytime? Do you have any idea about errors in any study? Type 1 error, type 2 error, any idea?
There may be subjective error,
Yes.
or there may be error due to, I mean, the instrument which we are using.
Okay. So error, okay, I'll tell you error in a different manner, because see, errors are again a very, very important part in your true experiments. Okay. For example, like I will give you a simple example. What happens in a court? कोर्ट में क्या होता है? Yes, any idea? कोर्ट में क्या होता है? कोर्ट में बोलते हैं the person who is being charged is pleaded guilty or not guilty, right? Pleaded guilty or not guilty, यही होता है. तो मतलब इसमें there are 4 criteria. Number 1, किसी ने चोरी की है और सबूत भी ये बोल रहे हैं कि उसने चोरी की है. ओके, किसी ने चोरी की है और सबूत भी ये बोल रहे हैं कि उसने चोरी की है. तो जज उसको सजा सुना देगा। क्राइटेरिया नंबर 2, किसी ने चोरी की है पर सबूत ये दिखा दिए गए कि उसने चोरी नहीं की। ओके, आर ऑल ऑफ यू विद मी?
Yes, sir.
हाँ, मैंने बोला किसी ने चोरी की है और सबूत भी बोल रहे हैं कि उसने चोरी की है। ठीक, तो भाई इसका मतलब है ट्रू। हाँ, उसने चोरी की थी और सबूत ने भी बता दिया भैया ठीक है उसने। किसी ने चोरी की है बट सबूत बता देंगे कि उसने चोरी नहीं की। ठीक है, उसी तरीके से किसी ने चोरी नहीं की और सबूत भी ये बताते हैं कि उसने चोरी नहीं की।
It's very dangerous.
ओके, किसी ने चोरी नहीं की और सबूत भी बता रहे हैं कि उसने चोरी नहीं की। ओके, गुड एनफ, क्योंकि उसने तो चोरी नहीं की थी और सबूत ने भी बता देनी चाहिए। बट किसी ने चोरी नहीं की और सबूत बता देते हैं उसने चोरी की है। ओके, तो दो
Yes,
जगह
sir.
पे एरर आ सकता है। पहला, किसी ने चोरी की थी और सबूत बता दिए नहीं चोरी की थी। जैसे सलमान खान ने गाड़ी चढ़ाई थी पर सबूत बता दिए कि सलमान खान ने गाड़ी नहीं चढ़ाई थी, ड्राइवर ने चढ़ाई थी, है ना। और
Yes,
किसी
yes.
ने नहीं किया था और उस पे इल्जाम लगा दिया जी उसने किया था। तो ये दो टाइप के एरर। तो ज्यादा डेंजरस कौन सा है? इसका दूसरा
Person who has
एग्जाम्पल,
the person who has committed crime,
द पर्सन
who has committed crime, but
or
there is no proof.
there is no proof. But what about the other one, the person who has not committed crime and still he is shown that he has committed crime?
Yes.
Yeah,
देखिए,
that is
बहुत
also.
बहुत क्रिटिकली सोचिए, isn't it?
Yes, yes, sir.
क्योंकि वहां, ठीक है ना। अब जैसे इसको मैं दूसरे वे में लूं, ठीक है, हम प्रेगनेंसी टेस्ट कर रहे हैं। ठीक है, एक लेडी है, प्रेग्नेंट हो भी सकती है नहीं भी हो सकती। तो टेस्ट बताता है कि प्रेगनेंसी है और टेस्ट ने भी बता दिया प्रेगनेंसी है। ठीक है, प्रेग्नेंट है, टेस्ट ने बताया नहीं है प्रेग्नेंट। ठीक है, अगर ये टेस्ट ये बता दे कि मर्द प्रेग्नेंट है, देन क्या होगा? एरर है ना भाई। ठीक है ना, क्योंकि वो हो ही नहीं सकता पर फिर भी टेस्ट बता रहा है। तो इस तरीके से
Yes,
टाइप
yes.
1 एंड टाइप 2 एरर को डिफाइन किया। तो टाइप 1 एरर इज मोर डेंजरस। जो बेगुनाह वाली जो कहानी, अगर बेगुनाह आदमी जो चीज नहीं हो सकती थी बट वो भी आपने कर दिया। ठीक है, तो मैं इसको और डिटेल्स में जब हम इसको पब्लिक हेल्थ के संदर्भ में समझेंगे, तो जस्ट टू इन ऑर्डर टू ना थोड़ा सा मैंने आपको कैजुअली बताया कि रिसर्च डिजाइन में एरर्स और ये इस तरीके से इसको लेना बहुत इंपॉर्टेंट होता है, so that you can do a proper study in public health, because public health research is a very sensitive area. Suppose you are working with any population, है ना, you are working with what type of a population. I will just take you to the another slide, just a minute. मैं आपको अभी दिखाता हूँ, एक मिनट। Yeah, all of you can see the screen.
Yes, sir. Yes, sir.
Yeah, visible.
Okay, so see, you all go through the quantitative variable, qualitative variable. मैंने सब पढ़ा दिया ये। Theoretical applied research क्या होता है ना? You just go through it, है ना? Just read it like a story, so you will understand everything. उसमें अगर कोई आपको कहीं पे भी डाउट नजर आता है, कुछ है, तो just let me know. Okay, next class में we'll discuss everything. तो जो भी आपके सवाल होंगे। अब ये एक और एक टाइप का स्टडी होता है, मैं अभी आ रहा हूँ, जो मैंने अभी आपको पार्ट बोला पब्लिक हेल्थ रिसर्च में यूज होता है, विच इज नोन एज द पार्टिसिपेटरी एक्शन रिसर्च। ठीक है, पार्टिसिपेटरी एक्शन रिसर्च बहुत ज्यादा यूज होता है पब्लिक हेल्थ के डोमेन में। व्हाट हैपेंस, इट डील्स विद द रियल वर्ल्ड प्रॉब्लम्स। जैसे मोहम्मद यूनुस ने किया, पॉवर्टी का और हेल्थ का क्या संबंध है, कैसे करके डीमोनेटाइजेशन लोगों की हेल्थ को कैसे इफेक्ट कर लिया, अगर एजुकेशन नहीं होगी समाज में तो वो हेल्थ को कैसे इफेक्ट करेगा। So you see, so basically public health is not only about health, but there are so many other variables, socio-economic factors which might affect. तो participatory action research उस तरीके की रिसर्च होती है जो रियल वर्ल्ड प्रॉब्लम्स को स्टडी करते हैं। इसलिए आपने मेरा वो जो वीडियो देखा होगा, उज्जवल, आपने मेरा वो वीडियो देखा था जो मैंने पब्लिक हेल्थ, एक
Yes,
पब्लिक
sir.
हेल्थ
Yes,
प्रोफेशनल में
sir.
क्या, कैसा लगा वो वीडियो आपको?
अच्छा अच्छा सर, और भी तो है, मतलब कंप्लीट नहीं हुआ था।
नहीं वो तो है, बट मैंने उस वीडियो में ये बताया है कि व्हाट अ पब्लिक हेल्थ प्रोफेशनल में कौन कौन से स्किल सेट होने चाहिए, राइट?
यस
तो
सर।
तो मैंने आपको ये बोला था कि भाई हर पब्लिक हेल्थ प्रोफेशनल में किसी एक डिजीज को लेकर महारत होना चाहिए। सेकेंड, उसके अंदर हेल्थ इकोनॉमिक्स को समझने की शक्ति होनी चाहिए
यस
कि
सर।
कि उसका कॉस्ट बेनिफिट एनालिसिस, उसका इम्पैक्ट क्या होगा, राइट? तो जब आप
यस सर।
पार्टिसिपेटरी एक्शन रिसर्च करते हैं, ये आपको पब्लिक हेल्थ रिसर्च में इट इज गोइंग टू बी वेरी वेरी इंपॉर्टेंट क्राइटेरिया फॉर। सो टुमारो इफ यू वांट टू वर्क विद WHO, वर्ल्ड बैंक, so you need to have this type of a skill set to understand the gravity of the situation, to understand where the real impact, how you can make a difference in the,
रियल सिचुएशन।
yeah. For example, I will give my example. When I started this college in 2008, so I took a research hypothesis. My research question was, those children who get more than 90%, they always have a chance. Okay, they can do anything, because I was seeing, because lot of dentistry students, because majority of the students who were passed out dentistry, they were doing job for 15,000, 17,000. In Delhi there was a one job of JR and there are 500 applications. Okay, so I was really surprised, like why this is happening. So I wanted to make a cohesive model in education where I can take students from those students who have scored 50% marks up to 80%, and where they can easily get a job for around 30, 35, 40,000, which is quite respectable in there, with a very low fee structure, means a very competitive fee structure, where even a child can afford, and with a very inclusive model. Because what I found out, because in Delhi NCR, what happened, a trend started where a lala means a person who is more interested in just doing business. He had opened up a college in between the fields, and he used to charge 6 lakhs 7 lakhs for engineering, and tomorrow the student paid the money, he did engineering, but after that the student was jobless. This is what is happening in India right now. Okay, so nobody is accountable. The government is not accountable, the people are not accountable, the college person is not accountable, and the parents, the poor parents who put up 6 lakhs 7 lakhs, what did they get in return? Nothing. That's why in India during COVID, almost like 11 crores people lost their jobs. And this
यस
is
सर।
the basic problem, because there are two basic problems in Indian education system. One, the students they lack skills, okay, technical skills. For example, if I tell you, how many of you know Excel? How many of you are really competent in doing Excel? Because Excel is nowadays it's very mandatory for any type of profession, and especially when you want to do a research based job, you want to do public health research. So you will be dealing with this subject when I will be teaching you statistics. Okay, so when you will be studying statistics, you really need to have a hands-on experience, like how to use an Excel at least. So if you know how to handle
यस
Excel,
यस।
at least 70 to 80% things you can do yourself, no problem. Okay, now the second skill set is that student don't know how to communicate properly. They know the answer, but they in an interview they goof up. They don't know how to answer to the question, how to arrange the things in a very systematic manner and present in front of the interviewers. So the basic problem is of communication, both verbal communication and written communication. So if you improvise on both these things, definitely the students can get a job. So this is the real, this type of a, so I tried to resolve this problem. Similarly, you must have seen we have created that group, AIHMS Health Man, where we put up jobs. So as the students learn the techniques, they are confident enough in the quality control, quality assurance, they apply for the jobs. So this type of a research in practical way, this is more like a participatory, because we are trying to deal and find the practical solutions and answers to these questions. You got the point? For example, I will share, there was one student of mine, her father used to earn only 10,000 rupees, and he had got 3 daughters. She is from West Bengal. And I brought both the girls together. We taught them for 3 or 4 months. We trained them, and both the girls got a job in BL Kapoor Hospital. Stipend they used to get around, the starting stipend, one girl, because her elder sister was studying masters and the younger sister was studying bachelors. So I tried to make some way for them, and we tried our level best in order to accommodate both of them. And based on this, then what we did is, like, the elder sister got around 13 or 14,000 as stipend, and whereas the younger sister got 8,000. Now, in a family where the father was earning only 10,000, now they started to take care of everything. Okay, themselves, like living in Delhi, taking care of their own expenses, and the father also supported by some manner. We also tried to support, and within a span of 2 years, then they started, the income increased to 40,000. Now they are earning at least 80 to 90,000, both the sister, and they have taken care of the third sister. So education has real value in changing the life of people. Okay, but you need to have a practical solution, like how it is going to work in those areas. Okay, so this is one of
Yes,
the
sir.
examples of participatory action research. There are students with me who within a span of 3 years, their income from 35,000, they are earning almost like 2.2 lakhs per month. Okay, working as one of my student, Pradeep, is there. I taught the same thing which I am talking to you, but some of the students imbibed those things very categorically, and they really did wonders. Okay, so what I'm telling you is not rocket science, but it is a very practical way of approaching a problem, understanding a problem, okay, getting down to the basics and finding the right solutions for different type of problems. Because see, it is like a null and like a lock and key hypothesis, what you used to study in enzyme mechanism. Every lock has to be opened by a specific key. You cannot use the same key everywhere. So for that, you require a thinking mind, a very transparent approach. Okay, the trust building has to be there, and it is like a teamwork. So participatory action research used in participatory research focus on the processes and the capacity building. How you build the capacities of people, how you change them. Okay, so all the developed countries who followed this model, this is 5 minutes. So they basically converted, changed themselves from developing to developed economies. So this thing can be done at a citizen level, this can be done at a village level, this can be done in health, in education, everywhere. But depends on who does them and how does it, how it is being done. Okay, so this is the most latest which is being done everywhere. So the PR process is intended not only to produce useful and sound information, but also build capacity among the research participants. The capacity building occurs as community workers. So, it is a part of because participatory research we use in public health, where the capacity building, because as community members, they identify, for example, you take Anganwadi workers, you teach them, you train them in research, so that because they are your most effective manner, they can actually bring about some community development in people.
Yes,
But
yes, yes.
how do they do? what, because they have not studied research. They have not done masters in public health. You have done. But in order to bring about certain change, you really need to work at the grassroots level. So if you are doing any research in the in an AC office, and you are making what if the government servants are doing, then there will be no change that you can see in the field. But if
Yes,
real
sir.
grassroots, if the government is willing to do just even 20% or 25%, still it has got the capacity to bring about a tangible change. But unfortunately, neither the bureaucrat nor the people, majority of the place, I'm not saying everyone is like this, but then there are a lot of other
Majority of
issues
people.
that why it is not. Is it clear?
Yes, sir. Yes.
Okay, so based on this, there are various stages. See, stage 1, clarity, clarify the purpose of research, why you want to do it, what are the goals, what are the general strategies, value of the research participant. So we will discuss these things, all the stages in details in the next class. Is it clear?
Okay, sir. Yes, sir.
Okay. Yes, any questions? All right.
I have just one things to say that
Yes.
as there are, this is a heterogeneous group we have here, and we are, some of us are having experience for in public health for some years, and some participants are that they are the beginners. What we can have that whatever you want to bring forth in the next class. I mean, what we are actually going to learn in the next class, if we can have just outline, so that we can go once again, just for the in our leisure hours, we can go through that, and when you will teach, at that time we'll be in a better position to make ourselves understand what we really want to understand. Because so many things are we can also understand, but then there are some points which need clarifications. So if you can have, you can, if you can let us know that.
Sure,
this
sure, sure. So in the
will be
before
very,
we're doing, I will be sending a case study to all of you. Okay.
okay, okay.
For like understanding this participant, understanding the various stages.
Yeah,
Okay.
yeah, yeah, yeah.
Okay. So based on this case study, then we'll try to understand
Yeah, yeah, yeah.
all of those factors.
Okay,
So today is Monday. So I will send you the case studies by Thursday. Okay.
okay, okay.
So Thursday, Friday, Saturday, you can all go through. Okay. And on Sunday, we'll have that. So 3 days. Okay. You can go through.
Because we are having also when we are interacting with you also, by interaction, we get more and more knowledge, by just following the, I mean, the slides and all that. If we can interact with each other, with the presenter and we are the
No,
participants, so
exactly.
so we
I
can
also,
learn,
and that's why,
and
now I
becomes,
have
it
given,
becomes very much interesting also, no?
yes, yes, yes. And now when I've given you the study material, okay, now you can go through the slides and I will tell you what we are going to discuss. Okay. And whatever extra material I want to give you, I will send you.
Sure, sure.
So I will send you a case study by Thursday, and then you can all go through that case study, and we will have a heart-to-heart discussion regarding the various stages. Okay.
No, no issue. Thank you.
Okay, sir.
Thank you so much. Thank
Okay.
you.
Good night. Thank you
Good
so
night.
much,
Good night.
everyone.
Okay.